a honorary member and educational speaker of World Medical Students Association. So today, Faisal, are you there?
Yes, I'm right here.
Okay, I'm going to give the speech to Faisal to start the presentation. Thank you.
Great. Thanks a lot, Roger. It's a pleasure to be here with everyone and to have you all share this time on a topic that's probably not talked about enough within our communities in different parts of the world. And I think, like Roger mentioned, I think I want you to see this talk as a discussion from one student to another student, rather than from someone who's at a different level of shared experiences. So I'll be sharing my screen now, and feel free to ask any questions at the end as well. So like Roger introduced me, my name is Faisal Nawaz, and I am a final year student in Dubai. And here in Dubai, we have a 6 years program to become a doctor. And I'm 5 months away now from completing that. So I'm just as excited as any other new doctor would be. And I think a lot of you are also students from different backgrounds. So hopefully we all get to see that graduation day for us coming soon. So I'm also an honorary member and speaker for the World Medical Students. And that on its own has been a great experience working with the team in organizing such talks with you from different parts of the world. So my talk today is about going inside the student's mind. And that means really going inside my mind, your minds, and giving really a perspective to our challenges and the issues and problems we face when it comes to mental health. And what are some of the opportunities that we could use as students in the mental health field? And I hope that this talk in the end gives you some ideas, some opportunities, and hopefully a chance to help other people and students also think like us. So before I move on, I have a simple question for all of you to think about. We keep saying mental health, physical health, and just health as a word. And then we have the word wellness and well-being, and they're often used quite interchangeably. And I think they're not quite the same word. So what I want you to think about is, what is the difference between the two of them? And it's an interesting explanation. So health is what the dictionary defines as the condition of being sound body with emphasis from without any pain, without any disease, as long as you have a normal body, that is health. And then there is something called wellness, where it is more than just existing. It is about a state of being where your physical, emotional, spiritual, social, environmental, all of these aspects of your health are taken care of. So what we really want for all of us as students, as humans, is to aim for wellness, not for health. And if you take care of yourself from different areas of life, then you're going to have the wellness that you need. We don't just want you to be free from diseases and have a normal body. Of course, that's something that will come with health. But more than that is when you're happy, when you're at peace, and that comes when you take care of different kinds of health, like this slide talks about. And now, why are we talking about the struggles and the issues of students around the world? Why is this topic so important? Well, it is important because what I'm sharing with you here is 3 research studies. And there are a lot of research studies out there, but I picked 3 examples for you where we are seeing medical students, and not just medical students, but students in all fields, have a lot of stress and burnout and a struggle with their own wellness. And it's not surprising if you think about our lifestyle or working pattern or exams, the stress is crazy. So one study here talks about how there is a high rate of depression, anxiety, stress in different people in our students' population. We're also seeing problems with lifestyle habits in students. And this is in all parts of the world, not just in Asia or Africa or Canada. This is all around the world. So clearly there is something wrong that is going on in the education system or in academia that is putting this much pressure on the student. And I think we all can agree that that needs to change. Now, why do we have this stress? Why do we have so much of mental health problems in the student population? Now, this is a difficult question to answer, but I could think of 4 main points. The first point is a lack of wellness integration in the curriculum. What does this mean? This means that our universities and schools are not doing enough to teach students to take care of themselves. And it needs to go into the curriculum, into your studies by your school and university. Now, that's point number 1. Point number 2 would be limited allocation of time for self-care and fitness. What does this mean? Well, this means that universities and schools are not giving enough time for us to take care of ourselves, for us to take care of our mind, our body, our fitness. And instead, we're still told that you need to be healthy, you need to feel happy. But if we don't have the time, then how are we going to feel happy? How are we going to work on ourselves? The third point is minimal incentives to focus on health and well-being. Now, this means that there is not enough reward from our schools and universities to help us see the importance of mental health. So this is an important part, because when we think of reward, what comes to our mind? Reward in school, reward in universities. It's usually in the form of exam scores, in the form of doing good in exams or reading a lot of books, but no one rewards us for taking care of ourselves. And I think that's something that schools and universities need to focus a lot more on. And the last point is that there is a deep-rooted stigma that is related to mental and physical health in society. What does stigma mean here? So stigma really means that we don't talk about mental health enough. We don't talk about the problems and the stress in our lives a lot. And I think that is the first step to any change that we need. We have a lot of good topics and teaching about physical health, diseases, and about the body, but we don't talk about emotions. We don't talk about sadness, happiness, depression, when it is so common. So we need to also look at how the stigma of mental health is something that needs focus and attention. So I've given you 4 problems that we have right now when it comes to mental health for students. Now, the question is, what is the solution? What are our opportunities for change? Because we all hear about problems and complaints all the time, but what about an answer to these problems? So the answer to your problem and my problem of stress in medical students and students around the world, I think comes from the change that we need. And I think this quote really shows that in a nice way, that we need to be the change that you wish to see in the world. Before you go ahead and ask for your university or college to be different, I think you need to start from within, start from yourself. So how can we start from ourselves? So this is one way of seeing it, where there are different levels of change that you can bring to mental health in the world. The first step is to start with yourself. This is by taking care of yourself, giving yourself enough break, not stressing out about things that are not in our control, and at the same time, knowing that work, studies, exams, all of these are important, but they are not everything. There is a much bigger life out there than just exams and just books and just stress. So this is the first step. Start with ourselves. Take care of yourself. The second step would be take care of your home, the mental health of your home. So you have a family, you have brothers, sisters, parents. This is a good place to start talking about mental health. Ask them what makes them sad. Ask them what they need to feel happy. And make it normal to talk about emotions. The third level would be to bring change in your work environment. So this would mean in your job, in your university, in your school. This is where you can start talking about it in the form of research projects or as a speaker, or basically raising awareness through projects. The fourth point would be in the community. And I think this is a very exciting point, because every community in the world, no matter where you come from, needs awareness on mental health. So go out there, start to talk about mental health within your community, create activities, create opportunities, make sure that there are people who can be a team together when it comes to talking about mental health. And this counts as awareness. Now, what I have are two examples for you about how communities can come together thanks to your idea, thanks to your change. And one example here is by starting clubs in your university or in your school. So in my university in Dubai, we have a club called the Health Awareness Club. And what we have done is brought together students from different backgrounds and created activities that raise awareness on mental health, physical health, different diseases. And this creates an environment where people are enjoying awareness about health. So this is a good example for you to look at and maybe bring something like this to your community. The second example I have for you is an initiative called Students Against COVID. So when we had the COVID-19 pandemic and all the lockdowns and problems, students from different parts of the world using social media came together, and they started using social media to talk about health and to talk about mental health. And this is a place where I think us students can make a very big difference in. We can make such a good and powerful impact using social media. Use the internet, use Facebook, WhatsApp, be the pioneers for change using the internet. We talk about so much bad that happens from the internet, but I think there's a lot of good in it too. And that good can come from students. So in the end, when you look at challenges and growth and opportunities in mental health as a student, you will start seeing a change that is beautiful, that is in a way that will help you achieve all your bigger goals in life because you started to take care of yourself. And I think when you take care of yourself, you can help others. Just like when we go on a plane, and when the oxygen mask comes down, we put the mask on ourselves first, and then we give it to the person next to us. That's exactly how mental health works. We need to start thinking about ourselves before we can care for others. Now, my last slide here is a very interesting one, and a slide that maybe you want to take a picture of or remember for a long time, because what I have done is spoken with the experts of mental health in different places. And I have asked them, can you give me one piece of advice that can help students improve their mental health? And I'm going to go over them now with you. So the first one is by Dr. Mehnaz Zafar, who is a psychiatrist in Dubai. And what she said was, assess your defense mechanisms, which might explain why one procrastinates. So what does this mean? Well, this means that try to understand what stops me from achieving my goals, what stops me on a mental level, and why do I procrastinate when it comes to achieving my goals? When we start to think more about ourselves, not blaming others for our failures or for our challenges or setbacks, but when we start looking into ourselves is when real change comes from within. And then we are no longer stuck because of our situation, because of our problem. We use our problems to learn about ourselves. Now, the second advice is by Dr. Bhavna, who is a counselor in Dubai. And what she says is, lessen your emotional baggage that you have been carrying over the years. So this is an interesting one, because what does she mean by an emotional baggage? So we all carry some sort of an emotional story or a challenge that's very unique to us. And it is important for us to make this challenge and make this baggage that we're carrying light, because no matter what you're studying right now as a student, when you go out there and you work, so for me, when I go out there and I work as a doctor, if I am going to carry all the emotional pain and mental health problems and challenges inside my head, how can I take care of my patients? How can I take care of the community? And that doesn't mean just as a doctor, I mean any job you do. So to give your 100% for a job, you need to lighten your emotional baggage. The third advice is by a psychologist in Dubai. And what he says is, make an effort for things you enjoy and practice self-care in order to avoid burnout and achieve your goals. Now, I love this because in our schools and universities, the definition of success is all about achieving scores and coming top in our class. But what this doctor is telling us is, make an effort for the things you enjoy. And it's important to make sure that you're doing things that you like. And success doesn't have to come from just one place. Success can come from different areas of life. It can come from family, from hobbies, from doing anything you like. So don't make yourself pressured by only looking at exam results as success. You are more than a number. You are more than a result or one exam. And you deserve to enjoy life at the same time in order to work hard for the things that matter. And the last advice I have is from my mentor, who is also a psychiatrist in Dubai. And what he says is, when it comes to my mental health, I am most grateful to my parents. Their love has shaped my beliefs and views about the world. Their values are my values and have become the source of comfort when I am distressed. The values of acceptance, gratitude, and compassion. Now, this is a lot to take in, but in a very nice way, because this means that at the end of the day, no matter what stress we go through as students, sometimes the answer to that could be taking a step back, going back to our roots, going back to our family, our friends, people we trust, people who have our best interests in mind. And in the end, no matter how big the stress is, if we practice gratitude, if we practice compassion, and we make sure that the priority is our happiness and our peace, then no stress or no challenge is going to be big for the student of 2021. Thank you.
Okay. Thank you very much, Faisal. It's been a very, very nice presentation. And I think everybody has gotten something new in this presentation. So I would like to give you the floor to ask your questions. Okay, Faisal, you have the floor.
Great, thanks a lot. And just a note, I'm here now to answer your questions, like Roger said. And if you have any question, just unmute your mic and you can ask me anything. And this can be anything, if it's about professional life, personal life, anything that can help with your mental health.
Ok, ce que Faisal demande, c'est que si vous avez des questions, bien vouloir les poser maintenant parce que bientôt, on va être à court de temps. Et les questions peuvent être du domaine personnel, professionnel ou académique. Donc, il est ouvert à toute question. Merci. Et vous pouvez juste vous poser la question, vous activez votre micro et vous posez la question. Si c'est en français, je vais traduire après. So, we are waiting for your questions.
There's also the chat box if anyone wants to just type their question. So feel free to type in the chat box. Otherwise, Roger, you could even translate for them if they'd like to speak in French and then translate it in English. Yeah. That also helps.
Yeah. Okay, for me, I have a question. It's a personal question related to my academics. So, Faisal, how do you manage? Maybe if you are active in other associations like maybe in SAC, in Students Against COVID, or in World Medical Students, how do you manage? How do you manage to cope with the workload in the medical faculty? Like maybe when you have an exam, maybe in 1 month's time, and with all these occupations from these associations, how do you manage with those?
Right. So that's a very good question, Roger. And I think it's a question that we all have and we all struggle with. So I can answer this in 3 ways. One is make sure that you always have a plan to what you're doing. So when it's an exam, when it's an event, when it's a talk, make sure that there is some thinking that you put before the thing itself. And I have been a student who never used to plan before and who used to do things very last minute. And that also works for a lot of us. We like to work at the last minute. But what I realized is in the long term, it just causes a lot more stress, a lot more burnout, and even decreases our quality of work. So try to prioritize things, try to plan. And for me, that can be if I am looking at an exam, going out for movie, going out for food, I just try to create a plan where I understand what is the most important thing for me, what is number 2, what is number 3. If I can at least put a ranking to that, I think it feels more clear. And the other thing is, even after all the planning, it is okay for the plan to not work out. And it is okay to say no. And that is something I took a long time to accept, where sometimes there's a lot of opportunities, a lot of projects, a lot of friends that call us for different events. And it's important to learn to say no to some opportunities. Not every opportunity has to be a yes for us. And when we learn to balance that, I think then we understand that, yes, I can maybe do 3 things at the same time, or maybe right now I only feel like doing 1. And that's okay, as long as I can say no and choose myself, choose my peace over anything else.
Yeah. Thank you very much. Thank you. Thank you.
Hello. Hello. I'm from Ukraine, and first of all, I'd like to thank you for your presentation. It was like really great for me to hear that from you, and it's like kind of something new in my life, because I've never been to such presentations of the students of the university in Dubai, and I'm really eager to know everything about your life, like how did you enter the university. But first off, today we've been talking about the world and our dreams. I mean, what do we want to change in this world? And I'm just interested in what is your biggest dream in life? I mean, what's your priority number 1? What are you doing? It's like, why do you leave it all?
So I'm sorry, I didn't get your name, but thank you for the amazing question.
I'm Nastya. I'm Nastya.
Nice to hear from you. And I think the question you've asked is a $1 million question. I think this is a question that we can take a lifetime trying to find an answer to. And sometimes the answer to this question, what is my biggest dream, can even change at different times of life. So for me, when I first started medical school in Dubai, so I have been born and raised in Dubai from the beginning. And when I finished my high school, I wanted to become a doctor. I loved kids, and I thought that maybe becoming a pediatrician is something that I would like to do. And then I started medical school. And then during that time, I realized that I have a lot other interests too that I did not know before. And then my biggest dream of becoming a pediatrician started to change. And I started having more dreams, or maybe dreams that are more than one. And right now I'm at a stage in my life where I am coming close to the end of medical school. And I still don't have answers to a lot of the questions and dreams, but I know that whatever place I am looking into, I hope that it creates an impact. It makes a difference to people's lives. And more importantly, it is something that I find peace with. So from a more objective point, I have an interest more now in mental health and psychiatry. So I am looking to specialize to become a psychiatrist. And hopefully more people find inspiration in this. I'm also interested in research. So on my side, I also do a lot of research projects. And I am also interested in technology. So how does technology play a role in medicine? So we have some cool things coming up in the future, like artificial intelligence and virtual reality for healthcare, for our patients. And I find that very exciting. So I don't know what the future has, but I'd like to see it combine these different dreams together. And with time, maybe even add some more dreams to that. So yeah, that's a small answer to the $1 million question. And you can always reach out to me through my contact details, and we can always discuss more.
Thanks. Sure. Thank you.
Most welcome.
Okay.
Hi, Nawaz. Please, I have a question for you. First of all, thank you so much for your presentation. It was really perfect, if I can say that. Okay, I would like to know, according to you, what you think is the best characteristics of an outstanding medical doctor or medical professional, and how to develop that. I'm Vanel, by the way, Vanel from Cameroun.
Thank you, Vanel. That's a very good question. And I'm glad you asked that, because sometimes it can take years for medical students or even doctors to think about this question. And the earlier we bring this question, I think the more time we get to work on it. And my way of seeing it, what quality makes a good doctor, there are many qualities out there, but the one that I appreciate the most is to be a good listener. Mm-hmm. And there is a reason for that. I have, through the patients that I see around as a student, I have seen that sometimes you can have the best of medicine, the best of technology, all the money, the best hospital, but sometimes all that the patient wants to feel better is to be listened to. And if you can give them your time, that could be the most priceless thing that a patient would want. And today we're seeing that a lot of the doctors, and this is through research, we're finding that they are not giving enough time to listen to the patient. And because of that, you have more mistakes happening in the medical profession. You have more unhappy patients because, yes, the patient will get the medicine that you have, but they will still not be happy with the way you treat them. And at the end of the day, you want to treat the patient, not the disease. And if you have ever been to the hospital as a patient yourself, I think you will see that the doctors you remember the most are the ones, not the ones who gave you the right medicine, but the ones who gave you the best quality and the best personality. So work on just being more patient.
And okay, how can I develop that personality?
Right. And that's another good question. So how can I be a good listener? I think we can work on that by just making sure that one thing that I did was every time I go to a patient, I ask them what brings you here. And then when they start speaking, try not to speak for at least the first 30 seconds. And trust me, it will be very difficult to not speak for 30 seconds. 30 seconds sounds like a small number here, but try not to interrupt the patient for the first part of what they're speaking. And if you can practice this, I think you will realize that the patient will give you the answer to their problem. Sometimes the answer comes from the patient. And I have had to develop that over the years by practicing. Sometimes I would stop the patient at 10 seconds. Sometimes it became 20 seconds. So it takes time to become a better listener, but we have to make an active effort to see that quality help people.
Thank you so much. Thank you once more for our presentation.
Most welcome.
Okay, Faisal, there's another question from Jacques Giovanni Maeva. Evening to all, my name is Jacques Giovanni. During the presentation, you say we have to go the others to ask what they want for them to look good. My question is to ask what strategies we can use, because when you approach such a person, he will tell you all the problems he is having. So how can we do to answer well to such a person without frustrating him?
Right. So first of all, thank you to Jack for such an important question. And I'm just going to repeat that question in simpler words. So what Jack has asked is that I mentioned during my talk that, make sure to go out there and ask people, what do they need to feel happy? What makes them feel sad? Ask them about their emotions. Now, what happens because of this is sometimes we don't know how to respond to them when we ask this question. And maybe that's why we're scared to ask this question, because we don't know if the person will become frustrated, or we don't know how to help them. So that is, I think, the question that Jack has here. And my answer to that would be to use a very simple approach. So you start with asking them how they're feeling or what their problem is. And again, listen to their problem. Trust me, sometimes 90% of the solution is only in listening. Sometimes they don't want a solution, or friends or family or patients. Sometimes they just come to us to speak and to be listened by someone. So start by listening, be a good listener, and try to validate their emotions. So by validate, I mean, make them feel understood. So if someone comes to me and he tells me, I'm having a very stressful time, my family is not helping me and I don't have enough money or any other problem. So you listen to them till they talk, and then you try to make them feel understood by saying things like, I'm sorry, and I don't know how hard it is, but it must be difficult for you. So when you repeat these things, like it must be difficult for you, it must be a stressful time, you acknowledge their emotion, you allow them to feel accepted. And usually this is what I do. I make sure that I am listening, and I make sure that I validate them. And usually when I do these two things, rarely do I have to give a solution. 70 to 80% of the time, only these two things get the job done. But most importantly, ask. Don't be afraid to ask how they're feeling, even if you don't know how to respond. It all starts from one question.
That's true. Very true.
I want to ask a question, please.
Yes, please.
Can I?
Yeah.
All right. First of all, I want to excuse myself for my